We've got time for some questions. I'm going to take chair's privilege and ask the first question. You all mentioned, I think, about the importance of developing relationships and trust. And I want to ask, how important do you think the approach you took, the use of visual methods, was in helping develop that trust and those relationships? And the second question, what tips can you give the rest of us for developing trust and relationships?
You know, you would think that building trust with the camera on would be harder than building trust without the camera because people feel quite vulnerable, as Dr. Tofi was speaking about. But like Rizka shared with us, that camera didn't emerge till the very end. I had at least 3 interviews, and not even interviews, I will call them conversations because they all happened over brunch and coffees. The first one is where I went to the clinic, and it was on the day of the appointment. I met them, some of them brought their mom with them. I spoke to them, I told them who I am, what I do, what the project was about, and asked them if they wanted to perhaps come see where I work and to see my office and to see some of the stuff I've made. And so I invited them into my space. And in that office, I then explained to them what the study was about. And I explained the consent process, what we would be doing. And then I said, if they wanted to come back, we could go for brunch. And so we did. And during brunch, I would ask them about their backgrounds. And then I physically turned the voice recorder around so that it pointed to me. And I said, now you can ask me anything because you've shared a lot with me. What do you want to know about me? And you can ask me anything. And it was from relationships to where I went to high school. I mean, anything they wanted to know. And then I said, this is what the project's going to be like. We're going to be exploring together. I'm going to be figuring stuff out with you. You're going to be figuring stuff out with me. We're going to learn how to do the camera together. We're going to shoot film. And every interview, we added another piece. But it was definitely a learning process. I think having the WhatsApp group was a big help because we already felt connected on the group. So let me just clarify, we never had a WhatsApp group with all participants from the very beginning. We had a WhatsApp group with myself, the one participant, and Rizka. So the 3 of us were on one group. And so Rizka and I had 7 of these groups that we chatted to individually to participants. After we had the weekend away, we created the big group for everybody. And that's the big group we still have. So I think building trust is a process. And like I said in the beginning, not every conversation is a data collection conversation. Sometimes it's just taking a walk in the park together. I know I took my daughter on a play date with one of the participants to the park and we had a picnic. And we just spoke about having kids. But that for us, it was something we shared in common. And just like she was opening her life to me, I needed to do the same because it was a long, intensive process together.
So something about stepping outside your professional role was
Yep.
was a key thing. I'm going to move on to, we've got some questions here. So someone has asked, how did you capture and measure the impact of your research?
So that's a very good question. Initially, we didn't plan on measuring the impact of our methodologies on the quality of the stories. That was never an objective of the study. The objective of the study was to look at the material environment and how it affected people's adherence to medication. Now, as a post-mortem process, looking back at the methods we adopted and the feedback from participants. So we've had several, just as we had multiple meetings in the beginning, we've had several debriefing sessions where we've spoken to the young women on camera and off camera about how they felt about the project, how they experienced the project, the highs and the lows. We've got feedback like we have from Dr. Tofi. We've got feedback from other researchers and healthcare workers who have been part of the process. So it's all qualitative feedback that we are receiving now that we are busy collating to look at the methodology that we used.
Thank you, Lynn. I've got a question here. I'll just read this out. How much time do the girls or young women spend at the clinic? And how do you know that the results you've observed are based on the research and not on the trustful relationships, for example, that staff have built up with those young women?
And if I can hand over to Dr. Tofi, she's prepared to answer that question. If you think about our seven participants.
For us, we really thought that the research itself really gave us a boost. The clinic itself, like I said, we were supposed to have set up a youth and adolescent group a long time before, and the task was just in general for the facility to actually have a adolescent youth service. But being in the HIV unit, having these girls already bonding over the research, it was very easy to actually form an HIV adolescent support group. And we're still running the youth group up till today. And these girls, we could see the girls that actually were together on the or on the research or forming part of the documentary. Those girls are a lot more closer bonded, but also just their confidence in terms of having the youth group sessions. I mean, during our sessions, we have a topic of discussion, and the girls that were part of the research and the documentary, they are more outspoken and, forthcoming with information. So for us, like knowing them before, I mean, they are young girls that were perinatally infected. So they've been attending the clinic for a while, and we sort of know their personalities already, and seeing the difference post documentary, there's a very visible difference. And one of the girls, she even said, she feels like a movie star, like a film star now. And she feels like she's important after this, taking part in this research. So their confidence has really improved. And that is just from our side, working with these girls 4 years before the documentary and after and up till today. So I don't think we have like a quantitative measurement, but we could definitely see the benefit of just the whole process of Lynn's research,
I wonder, if I create it's part of the answer as well, actually, that developing those trustful relationships is actually part of your intervention. That is actually becomes part of your research because that felt like a very deliberate thing that you all wanted to achieve.
Yes, it was quite deliberate. I wrote a paper which I can share with you to share with the notes of the session around allyship in research. And there was one of the first papers before we embarked on this project around how we wanted to engage with people in the research and saw them as allies, mutual respect, mutual benefit, mutual intelligence, mutual power, and I think that provides some insight into why we did what we did.